Based on the data from HAI surveillance network in Europe, over 3.2 million patients are infected at least once following an exposure in healthcare facilities across the European Union every year. As with any type of HAIs can trigger sepsis, particularly in people who are already at risk, such as those with chronic illnesses like diabetes, who are immunocompromised, such as those taking chemotherapy, the very young and the very old. Sepsis is a potentially fatal condition arising when the body's response to an infection damages its own tissues and organs. Sepsis, even if not known by the general public, is one of the biggest health issues in the EU and worldwide due to its high incidence, mortality and economic cost. Globally, approximately 27 million people experience sepsis each year, and only around 80 million survive. This means that more people die of sepsis than from heart attack, HIV-related diseases, lung, breast and prostate cancers. So it is easy to understand why early diagnosis is so crucial, as every hour of delay in accessing appropriate antimicrobial therapy increases mortality by 5 to 10%. Every year in the EU, more than 46,000 people die because of sepsis. Of course, sepsis also contributes to deaths in cancer patients, people with heart disease, accident victims, and those suffering from so many other conditions. Estimates suggest that the number of deaths where sepsis is a contributing factor could be 10 to 15 times higher. In Europe, the cost of severe sepsis are typically 23 to 42,000 euros per sepsis period per patient. In the EU, there are 300 to 500,000 severe sepsis cases, 6,200 per 100,000 inhabitants. These cases cost 7 to 21 billion euros of healthcare costs per year. This situation is unacceptable, so I believe there is an urgent need for action. These human and economic costs can be dramatically reduced through better hygiene, better prevention, and better early diagnosis and screening. Infection prevention and control, as a practical, evidence-based approach, prevents patients and health workers from being harmed by avoidable infections. Preventing a timely diagnosis can avoid unnecessary harm and even death. It saves money. It reduces the spread of antimicrobial resistance and supports high-quality, integrated, people-centered health services. As a member of the Public Health Committee, I have been working to make sure the patient safety, HAIs, prevention, screening and management, including sepsis, have the necessary attention in the EU political agenda. But much more needs to be done, because at EU level, we don't have a comprehensive and concrete action focus on HAIs, prevention, screening and management, including sepsis. We need to work together, join and exchange our expertise, and I welcome initiatives as the European Network for Safer Healthcare, where high-level experts and associations have decided to offer their expertise for the common goal: building a safer healthcare system. As stated in the World Health Assembly on Sepsis, adopted in May 2017, it is necessary to draw attention to the public health impact of sepsis and identify successful approaches for integrating the timely diagnosis and management of sepsis. We need to work together at all levels of governance. The European, national and regional levels should make a joint effort to protect our health, everyone's health. I was delighted to receive the invitation to support such an important initiative. Therefore, I would like to invite you in the near future to my country, Portugal, to discuss with our experts the prevention, diagnosis and better management of infections and sepsis. I wish you all a fruitful meeting and thank you very much.